At least 166 people will suffer a fatal brain injury every day in this country. For those who survive, they can suffer both short and long-term symptoms. An organization has been built on the mission to help create cohesive health care. We'd like to welcome Lynne Becker, CEO of Power of Patience. Great to meet you.
Thank you. Thank you so much, Layla, for having me.
And I like the play on words, power of patience, putting the power of the back into the hands of the patient.
Yes, and you got it. That is exactly what the entire name of the company is to represent. By empowering the patients and know what they can do to improve their health care, gives them so much more in terms of the trajectory of their recovery and working with their doctors.
Absolutely. What was the inspiration behind you starting this organization?
In my daughter's youngest, my youngest daughter, when she was injured in 2015, a boy hit her on the side of the head with a soccer ball, and it turned all of our worlds upside down, particularly hers. So that was my inspiration. And at the time, I was listening to all of the doctors, and we were told it's simply just a concussion, just let her rest. And it wasn't until a year and a half later that we discovered it was not just a concussion, it was a traumatic brain injury.
Wow. So what changed after her injury?
So what changed after her injury, her optic nerve was also torn, and she even stroked after the event as well. And essentially, her entire body broke. She had to learn to recrawl, rerun. Her autonomic system was not working. She could only endure going out at night. She couldn't go out during the day because of the bright lights. Loud noises set her off. It was a world I had never known. Panic attacks, fear of being left alone. And this was a child who was 98th percentile ranking in her academics and on her way to athletic scholarships as well. She couldn't even get in the pool any longer. I mean, it was truly an entire upside down for our world.
Wow. What was that journey like then once all those things changed in a matter of a nanosecond? You paid doctors, many doctors' visits, and what was that experience like for you?
Oh my goodness, as the caregiver, like you're sitting here thinking, first it's your baby and mother bear instincts kick in. But you're trying to listen to the doctors and all you're told is, well, we just don't know. And I'm thinking to myself, because I've done clinical trial research, how is it that you do not know? It seems like this is something that, because of the NFL, there should be a lot more knowledge around it. So as the caregiver, I was right there with the doctors trying to go along with what they said, but I could never get an answer. And I then couldn't understand it. And you look at your child or your loved one, and they look normal. That's part of the problem because it's invisible. It's in their head. So it's like a broken brain as opposed to a diseased brain. And there's a very big distinction between that.
So was it a combination, though, of visiting with doctors and assessing the issues and then the rehabilitation process? Did those two things seem separated in some way? Was there not a synergy between those things?
Right. I mean, I think you hit the nail on the head because you're going from one kind of doctor to another kind of doctor, and there's no unity amongst the doctors, right? So they're in silos already. They have a high specialty practice, so they're only look at that one little maybe condition when in fact your brain runs your whole body. So it was a lot of collaborative work.
So what is the Power of Patience?
So Power of Patience was created to empower patients and their caregivers so they could track these very symptoms and the triggers that make the symptoms worse. Because what also happens is there's a lot of recall bias. You might walk into the doctor one day and say, hey, I feel great, and you're having a really good day, but you turn around and either you forget that you were there because of the brain injury, short-term memory loss is huge, or you're really not the true you. Like you may just have a good day for that one day out of the month. So this is more of a movie, a timeline of the person's true physical overall health. And they choose exactly what's wrong with them. So it's totally personalized. And we give them reports and then they give it to their doctors.
I see. And how can people take advantage of what your organization provides? So if they have someone watching, that they have someone in their family that suffers from a traumatic brain injury, how do they use your services?
Sure, they can go to our website. It's free. We will never charge patients or caregivers, and they have a login button to set up an account. You don't have to have a special app. You just register through the website, and it takes about 2 minutes.
That's wonderful. Lynne, thank you so much for sharing your story with us.
Thank
How's your
you.
daughter doing today?
Much better, much better.
That's
Thank you
good
for
to hear.
asking.
That's good to hear. Thank you so much, Lynne.
Thank you.
We're back after this.